Colestid tablet is used with a proper diet to lower cholesterol in the blood, which can decrease the risk for strokes and heart attacks. It is important to follow a low cholesterol/low fat diet and make other lifestyle changes such as exercising, losing weight if overweight, and stopping smoking to help the medication work better. Colestid tablet is a bile acid binding resin, which works by removing bile acid from the body. This causes the liver to make more bile acid by using cholesterol in the blood, ultimately helping to lower cholesterol levels. Remember to consult your doctor for more details. The recommended daily dosage and optimal timing for taking this medication will depend on your individual health condition, so be sure to follow your doctor's instructions. When taking Colestid tablets, it is important to follow your doctor's instructions. Typically, you will take this medication 1 to 2 times a day, with each tablet being taken one at a time. It's best to take each tablet with plenty of liquid, such as water or juice, and swallow it whole. Do not crush, chew, or break the tablets. If you have difficulty swallowing them whole, consult your doctor. The dosage of Colestid tablets is based on your medical condition and response to treatment. Your doctor may start you on a low dose and gradually increase it to reduce the risk of side effects. It may take several weeks before you experience the full benefit of this drug. Cholesterol, the active ingredient in Colestid, may decrease the absorption of other medications. It's important to take your other medications as directed by your doctor, usually at least 1 hour before or 4 to 6 hours after taking Colestid. If you have any questions or need more information, consult your doctor or pharmacist. Remember to take this medication regularly at the same times each day to get the most benefit from it. Even if you feel well, it's important to keep taking it as prescribed. Most people with high cholesterol do not feel sick, so it's important to continue taking the medication as directed. If you are taking Colestid tablet, you may experience side effects such as constipation, stomach/abdominal pain, gas, nausea, and vomiting. To prevent constipation, make sure to eat enough dietary fiber, drink plenty of water, and exercise. You may also need to take a laxative, but be sure to ask your pharmacist which type is right for you. It's important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the risk of side effects. Many people using this medication do not have serious side effects. However, if you experience difficulty swallowing, chest pain/pressure, severe stomach/abdominal pain, unusual bleeding/bruising, rapid breathing, or confusion, contact your doctor immediately. While a serious allergic reaction to this drug is rare, seek medical help right away if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects not listed here, be sure to contact your doctor or pharmacist. If you experience any side effects, you may report them to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Colestipol, make sure to inform your doctor or pharmacist about any allergies you have, as this product may contain ingredients that can cause allergic reactions. Also, discuss your medical history, especially if you have swallowing problems, constipation, hemorrhoids, or kidney disease. Since this medication can interfere with the absorption of certain nutrients, your doctor may recommend taking a multivitamin supplement. It's important to consult your doctor for more information on this. If you are planning to have surgery, remember to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Older adults should be aware that they may be more sensitive to the side effects of this drug, especially constipation. For pregnant women, Colestipol should only be used when clearly needed, as it may affect the absorption of certain nutrients. It's best to discuss the risks and benefits with your doctor. As for breastfeeding mothers, while it is unlikely that this medication will pass into breast milk, it may still affect the absorption of certain nutrients. Therefore, it's important to consult your doctor before breastfeeding. Be sure to also check the How to Use section for specific details on how to take this medication. It's important to note that drug interactions can affect how your medications work and may increase the risk of serious side effects. It's not possible to list all potential drug interactions here, so it's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. Some products that may interact with Colestid tablet include blood thinners such as warfarin, mycophenolate, and raloxifene. It's important to discuss with your doctor or pharmacist how to manage these potential interactions. And always follow their guidance on the best time to take this medication and the appropriate daily dosage for your specific needs. If you or someone else has taken too much Colestid tablet and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call the local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of overdose may include severe stomach or abdominal pain. It's important not to share your medication with others. While taking Colestid tablet, you may need to undergo lab or medical tests to monitor your cholesterol, triglyceride, and vitamin levels. Make sure to keep all scheduled medical and lab appointments, and consult your doctor for more information. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take your next dose at the usual time. Don't take a double dose to make up for the missed one. Make sure to store Colestid tablet at room temperature and away from light and moisture. Avoid keeping it in the bathroom and always store it out of reach of children and pets. When you no longer need this medication or it has expired, be sure to properly discard it. Do not flush it down the toilet or pour it into a drain unless instructed to do so. It's best to consult your pharmacist or local waste disposal company for the proper way to dispose of it. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.